Hey, so in the research article that I was looking at, I was really interested in how caffeine affected fat metabolism. Like in Celsius, they claim to burn body fat and boost your metabolism. So in this article, the effect of caffeine intake on fat oxidation rate, it kind of focuses on during exercise. That's what their research was focusing on. And they did it in a dose response effect. So they did two different doses, like 3 milligrams and 6 milligrams versus a placebo. It was a randomized, double blind, placebo controlled crossover study, is how they talked about it. They got 18 recreational active men. Um, they found this by the men were a range from 19 to 40, um, and they had about 60 minutes of exercise for about 4 days a week for about 2 years, is how they were looking at it. And they experimented with them by giving one group 3 milligrams per kilogram of caffeine, one group 6 milligrams per kilogram of caffeine, and then one with a placebo. So they didn't tell them what they had. The trials were separated by 3 days. So it was three, then six, then placebo, and there was a 3 day separation in between, so that there was a caffeine washout. So it was a clean slate every time they tried it. Participants ingested each one as a capsule 1 hour before the exercise, and then the actual test was a cycling test, which put their VO2 max between 30 and 80% of it. Um, it included an indirect calorimetry to measure their calories. As you can see on the chart, in figure one is the example that I have right here. It shows the fat oxidation, carbohydrate oxidation, and then their VO2 max range. Um, so they were really measuring, hence the name of the article, the fat oxidation, carbohydrate oxidation, and then the energy expenditure that they were finding out during the whole test. They were also monitoring for side effects, um, as you should with all exercise tests and all research tests. You want to see what side effects, and then especially with the caffeine. Um, so, in my opinion, the three most important findings that I found were that both the 3 and the 6 milligrams of caffeine per kilogram of body fat increased fat oxidation. So it did what it was supposed to do. It increased that fat oxidation during submaximal exercise compared to that placebo. The maximal rate of the fat oxidation increased from, as you can see in figure one, it increased on a positive trend going up. Going up the trend, compared to that placebo. In the no dose, or that placebo, the 6 milligrams of caffeine did not provide anything greater than that three. So the three and the six were pretty much equally compared to, they both increased, but there was no like double benefits or greater benefits when they took 6 milligrams per that kilogram. Um, so you don't have to do that double. You could stay at that minimum level of that 3 milligrams as a show. Um, but the caffeine reduced some of the perceived exertion at high rates. So when that VO2 max was 70 to 80%, there was no real change in the heart rate or energy expenditure. So they were going at normal levels. They were just at that sub-max level. They were having more fat oxidation. Some future research ideas slash gaps that could be filled. They could include more than just the young recreational active men. They could do more endurance athletes or women. They could do an older population or like an overweight population, just to get more of a range in their statistics and data. Future studies could also examine whether results hold true when the participants have eaten versus not eaten before that exercise. How early in the day before that exercise do they take that caffeine, or the day before versus the next day. They only also did two doses, that 3 and 6. What would 6 or 7 or 7 above be? Or what about a lower dose, like 2? And then they also didn't really take into account certain biological things like blood or tissue samples. They didn't take that, so there was no real idea if that played a key role in certain people, or because some people have caffeine sensitivities. To apply this for a professional, like a sports or exercise professional, the study provides a good guidance for it. So about 3 milligrams per kilogram of caffeine is about 200 to 300 milligrams for most adults. Uh, this is They found that this was enough to boost that fat oxidation during moderate intensity exercise. If you go any higher than that, there's no real benefits in addition to what they're already getting. It does increase some side effects. So that's if you're weighing the chances, you get more side effects rather than benefits. Coaches and trainers and dietitians could recommend that moderate caffeine dosage, so that 200 to 300 milligram range, if they're looking for that fat metabolism at a moderate intensity, and endurance without that risk. This is perfect and would be really good for the public health and fitness programming, showing that everyday exercisers may benefit from that moderate caffeine before aerobic workouts, unless they have contradictions that can play into that. Other than that, thanks for listening.